What's going on, pre-Chiro students? This is Dr. Ben Glass again with a very vital conversation with one of chiropractic's leaders to help build context for you in not only deciding if this is the right path for you to become a chiropractor, but also really getting specific and focused on what type of path you might want to take through chiropractic school and beyond. So today we have Dr. Christopher Kent sharing. He's a researcher, I believe, a judge or lawyer previous to getting involved in the profession. I'll let him introduce himself, but I've been following for many years. And if you do some research online to study in this pre-Chiro program that we're proposing you engage with, you will find many different articles that have been published by Christopher. So can you just introduce yourself better than I just did and also just share what you're up to today?
Oh, sure. First of all, I'm not a judge. I
Okay.
am a lawyer, and how I got there is kind of an interesting story. I don't know if we'll get to that, but basically, I've been a chiropractor for a long time. I graduated from Palmer in 1973, and as a result of various challenges I saw the profession facing, I tried to acquire additional education and skills to help me in my quest to leave the profession in better shape than it was when I entered. And that involved getting a master's degree in psychology because I was interested in body mind relationships, uh, qualifying as an attorney because at the time I was serving as chair of the Health Committee of Non-Governmental Organizations at United Nations. And most of those people were lawyers. So I thought, well, maybe I should do this too.
Mhm.
Basically, developing those skill sets. But what I think might be interesting to your audience is kind of how it all got started. Um, I was in the same position that I think you folks are, in that I was trying to decide what to do with my life. And I knew I wanted to be a person who helped empower others to express their potential. That was really the prime directive. I wasn't saying, should I become uh, a medical doctor, a dentist, a chiropractor, a podiatrist, a psychologist, whatever. It was, how can I most effectively utilize my potential talent to help people express their potential and realize their goals? And I initially began by looking at things like medicine. I realized that really wasn't for me because I had a very natural spin. That's kind of the way I was brought up. Um, and I had very little medical intervention as a child. Um, Psychology, wonderful, but somewhat time limited. I had a friend who was a therapist who said, man, all I can do is about six people a day, and I'm at my limit. So, and some of the medical subspecialties like optometry, podiatry, and so forth, I kind of dismissed as not really congruent with what I wanted. And I really hadn't initially thought about chiropractic in the context of human empowerment. You kind of think of a chiropractor as being uh, kind of a musculoskeletal kind of practitioner. And at the time, I was about 16 years old, and my then best friend was encouraging me to see a chiropractor because I was experiencing a variety of health challenges. And I had no idea really what a chiropractor was. So I thought I'd ask my mother. Why? Well, not only because when you're 16, you kind of talk to your mother, but because she worked at the medical college. And I thought, well, she would certainly have some advice. And I asked her, what's a chiropractor? And she kind of had this scowl come over her face and said, a chiropractor? Why, that's someone who cracks your bones. And I was taken aback. I said, cracks your bones? You mean they fracture? And she said, I guess they must. You can hear them snap. I've seen it done. Well, I was a little bit nervous about this because my friend was seemingly rational and certainly ambulatory. And I don't think anyone was breaking his bones. So I said, how can I learn more about this? And I did something that I really suggest that you do, and that's establish a relationship with at least one chiropractor. So I just called a nearby office and asked if I could do an interview for school. And he said, sure, come on over. And when I went over, the thing that really impressed me was his concise and elegant description of chiropractic, which, quite frankly, I haven't heard better uh, in my almost 50 years in the profession. He said, chiropractic is based on four simple ideas. The first is that the body is a self healing mechanism. Cut your finger, it heals. Cut the finger of a corpse, it doesn't. Life heals. He said, second, the nervous system is the master system of the body. Every dimension of the human experience is processed through the nervous system. Every motion, every emotion, every thought, um, everything that you live, everything that you perceive, everything that you express as a human being is processed through the nervous system. And he said, third, and I admit it gave me goosebumps then, and it still does now. He said, when there's interference with the function of the nervous system, not only can it compromise your physical well being, but because it alters your perception of the world and constrains your ability to adapt and respond to the world, it can have psycho emotional consequences too. And when that happens to a significant number of people in a society, you have a sick society. And he said, fourth, what I do as a chiropractor is locate and correct the cause of that interference, vertebral subluxation. Well, that's all I needed to hear. I said, this is exactly what I want to do. But I didn't fully realize it at the time. So I became his patient. I experienced chiropractic care. Not only did the issues that I presented with resolve, but I felt better than I had ever felt, more energetic, more committed, and minor things that I didn't even mention to the doctor resolved. And it wasn't long before he said, well, I think you should become a chiropractor. And I said, well, I've been thinking about that. What does it entail? And he said, well, you have to go to Davenport. I said, well, why Davenport? He said, well, that's where it's done. You have to go to Palmer College. And he didn't even mention any of the others. And when I'm talking to people and they say, where'd you go to school? And I said, Palmer. He said, well, why'd you go to Palmer? Why didn't you go to Life or Life West or Sherman or one of those more subluxation oriented schools? And I said, they didn't exist then. Yes, I'm really that old. So, to make a long story short, after I graduated from Palmer, the next question I had in my mind was, how can I get chiropractic to more people? And that's how I became involved in education and research. So,
Mhm.
kind of a brief intro.
When you got involved in education and research, because I'm proposing that all pre-Chiro students see this path through the lens of becoming a scientist, a thinker, an artist, a teacher, an entrepreneur. Within that is the scientist and the teacher, which you just mentioned, education and research. And I believe we need more training at the fundamental level before you get to chiropractic school, because when you get to chiropractic school, there's really no time for you to learn how to do your own research and have a structured training. Can you describe what you believe students need to do to start on that path of learning how to do research, learning how to be a better teacher, or learning how to put together educational materials? Because I think that it's important we promote pre-Chiro students to start developing their own content based on, say, a conversation like this and what they take from it, or watching the interview did with Danny Knowles on YouTube, where you present a lot of different research on a PowerPoint, taking those research studies and going and how can they approach that? So if you could like start us from the beginning and maybe give us some really granular details on how to develop yourself into a researcher or potentially a teacher.
Well, if that's the career path you want, there are a number of things you can do. First of all, I really think that to be effective in that role, you should have some clinical experience. I know that's controversial, but There's nothing that beats patient care and patient interaction in defining your purpose and defining what kinds of questions really need to be answered and how they fit with this grander goal, as I put it, of becoming involved in human empowerment. The true value of research is only realized if it results in the patient understanding care better, understanding the basis of their care, if it can be an effective communication tool, not just with patients, but perhaps even more importantly, with policymakers and with individuals who are in control of the political system and the financial system. Um, Thought leaders, not just politicians, but individuals. Uh, we see a lot of sports celebrities, we see a lot of entertainment celebrities, people in the music business that are all chiropractic patients. Almost all major athletic teams have chiropractors involved. So the value in research is showing that there's so much more to chiropractic than merely the episodic symptomatic treatment of pain syndromes. Helpful as it may be, um, chiropractic isn't about treating pain, it's about empowering people to realize their potential. So, first and foremost, I'd say establish a relationship with a practicing chiropractor, shadow that person, and see what kinds of challenges they're facing with patient communication. Learn something about patient education strategies, what they're using. Some doctors do it very well, some don't even try. Um, Find out what it's like in the real world. Indeed, shadow a couple people if you can. Um, in terms of pre professional preparation, it really helps to take some of the hard basic science stuff before you get to chiropractic school. Um, I was speaking with a friend of mine who's on the staff here at Sherman College, and he has uh, a mentee uh, who recently graduated. And he said that the best advice that he gave this fellow in terms of how to get through was take the undergraduate biochemistry course so that when you get here, you're not struggling with it. Take a course in anatomy and physiology so that you kind of understand the grand scheme of how the body works and what the major structures and functions are. But in the context of research, same advice. There are a lot of undergraduate research opportunities out there, and we get students who come here with some experience. Um, you may find yourself in a variety of roles, ranging from feeding the animals to doing reviews of literature to assisting with the collection of experimental data and so forth. But if you have an opportunity to get involved in an undergraduate research program, at your college or university, by all means do that. For example, here in South Carolina, in our area, we have uh, the Upstate Research Symposium, which is designed for undergraduate students to give them a chance to submit papers for peer review, um, to do poster and oral presentations. And I think we have something like over 30 institutions participating. There were over 100 papers presented last time. So these opportunities do exist. See what's available locally, and if you can, get involved. And you say, well, gee, isn't this going to take up a lot of time? You're asking me to shadow a chiropractor. You're asking me to get involved in a research project that perhaps isn't part of the core curriculum. And the answer is yes, because another thing you need to prepare for is the rigor of the DC program. Um, this isn't a situation where full time is 15 credits, where you're in class 15 hours and maybe spend 5 or 10 hours a week in preparation and then cram for tests and fly through. It's a program where you're in school all day from like 8 to 4:30, and it's a program that involves some very rigorous basic science study. And when you get into the clinical phase of your Education, you need to spend time in the outpatient clinic and so forth. So get used to making a total commitment to your professional future and getting used to spending a lot of time doing that. But the
Mhm.
very good news, at least here at Sherman College, is that we do have a commitment to at least give interested students opportunities to participate in research. What we have in the regular curriculum now are three research courses which deal with evidence informed practice. And although they're designed primarily to make students good consumers of research, individuals that know how to search literature, individuals that can separate good papers from mediocre papers from truly awful papers, individuals that can apply the concepts of research to clinical practice, reliability, validity, sensitivity, specificity, clinical and statistical significance. All of these things are very important in designing your own clinical protocols and to critically evaluating the claims of people who are promoting techniques and people who are promoting various forms of management.
Mhm.
When you start to develop these critical thinking skills, not only is it invaluable in clinical practice, but we also can see these things applicable in the real world. I said, yeah, goodness. Now everyone's talking about COVID-19. Will testing save us? Will
Mhm.
vaccines save us? Well, let's take a critical look at the research. Let's look at how good the tests are. Let's look at some of the potential uh, statistical phenomenon that seemingly everyone in public health is overlooking.
Mhm.
Um, don't want to get into the details of that, but there are some real world applications that even go beyond chiropractic, but are necessary uh, to just function in society and certainly to have a role as
Mhm.
a teacher, which is what doctor means when you're
Mhm.
in clinical practice. The
Mhm.
other thing that we have available, besides these courses in the core curriculum, is that the Foundation for Vertebral Subluxation has sponsored a number of research fellowships for students that are interested in becoming involved in this. They include scholarships, modest stipends to help defray tuition expense, in exchange for which people work on our projects. For example, I have in front of me a paper that's been several years in the making on the prevalence of abnormal findings in 737 patients referred for MRI exam by doctors of chiropractic, and how these can relate to neurological consequences in vertebral subluxation. And I was assigned a research fellow who helped me with a lot of the somewhat tedious work in preparing that paper. The foundation is also involved in an immune system project where we hope to develop a practice based research network. So, in addition to full time researchers, where unfortunately funding is somewhat limited, uh, if you do elect to go into clinical practice, you have a number of research opportunities there. One, of course, is case reports, and another one is collaborating with a practice based research network where you collect clinical data which researchers can then utilize. Uh, and we're really hoping to get this off the ground where we have chiropractors relating objective measures of vertebral subluxation to various biomarkers associated with immune function. So the exciting thing about that is that we're not looking or limiting our perspective to specific diseases. We're looking at the unifying systems of the body uh, and the intimate communication between the nervous system and the immune system makes this very exciting. Another area where I have an interest is chiropractic and mental health, and we have some stuff on that that may be of interest to you. If
Mhm.
you're interested in seeing some of the stuff that we're doing at Sherman College, just go to sherman.edu, click on research, And there are a number of videos there of presentations that I've given about vertebral subluxation, about chiropractic and mental health and related fields. And we also have a list of the projects that are currently undergoing here at Sherman, as well as publications from the last, I don't know, 7 or 8 years or so. So
Mhm.
those are resources.
I've
For
heard
you.
I've heard you mention a couple of times funding is an issue. What would the research agenda look like? Maybe you've already drafted an agenda for the next 5 years. What we need more of in the chiropractic profession in regards to research. What would it look like if we had $100 million or even $1 million just randomly flow into the bank account of the research department? And also, are you collaborating with any other schools on some of those studies? Because when I was talking to Ron Oberstein the other day, it sounded
Mhm.
like they were also involved in some research. I was just wondering if, due to limited funding, it makes sense to create a consortium of schools that are involved in the same focused research to benefit the profession.
Yeah, that's something that we're hoping to develop, and that's why. And again, I've only been in this position for well about a year now, just before COVID hit at Sherman College. So it's been somewhat difficult to establish collaborations, but we did participate in the Upstate Symposium and made some good connections there. So hopefully, we'll see more collaboration. Um, I also met with some people from an osteopathic college, and it was kind of interesting because they're in a similar situation where we are, in that our primary focus is preparing practitioners. Um, so again, they too are seeking collaboration with more research oriented universities. So yes, that's part of it. If we had $1 million, we could implement our immune system project on the level we'd really like to see it. And bear in mind, $1 million sounds like a lot of money, but it really doesn't go very far in the field
I
of
said
research.
100 million first.
Yeah, the wonderful thing that we have developed out of necessity is the ability to get a lot of bang for buck and to use a lot of volunteer talent. Besides the students that receive the fellowships, we have students who are just volunteers who do it just for love of the profession and the opportunity to gain further experience. If we had $100 million, the agenda that I would like to see again would look at how the unifying systems of the body are operative in the dynamics of expression of both physical and mental well being, uh, actually, even social well being. If we go to the World Health Organization's definition of health, which was first promulgated in 1948, uh, health, what is it? Uh, Complete physical, mental, and social well being, and not merely the absence of disease or infirmity. And that's a wonderful vision, but it really hasn't been realized. So we would be looking at the nervous system. We'd be looking at some fundamental functional studies of the nervous system, including functional magnetic resonance imaging, looking at connectomes, looking at areas of brain activation, um, relating to vertebral subluxation. Uh, we would also be looking, hopefully, at ways of bringing technology from the laboratory to the office so that we can more effectively analyze and correct vertebral subluxations. We then also work with social scientists who would look at how a patient's perceived well being and how chiropractic care affects society as a whole. There's some very interesting research that's been done in social science and in psychology looking at how a person's level of happiness actually affects not only the people they have direct contact with, but secondarily the others. And we're seeing the role of the vagus nerve with polyvagal theory in the regulation of emotions and how that affects the brain. again, tying into the mental health aspect. So, by looking at nervous system function, immune system function, mental health, patient perceived quality of life, and finally, the economic dimension, because that's extremely important to policymakers. There have been some preliminary studies that have demonstrated spectacular cost savings in individuals under chiropractic care. Uh, they have significantly fewer medical expenditures. Um, the numbers are very dramatic, and I think if we pursued that, uh, that's another very fruitful area. So um, that's a tall agenda, but yeah, we could do that if we had $100 million, or at least get a good start.
Hmm.
So
And if we had the 100 million, we were able to do all this research. Who's going to carry it out? Do we have enough researchers in chiropractic to spend that money on projects that we can plug people into? And if that research was done and published in reputable journals, what type of policy change would we like to see follow that? If you're just using your imagination.
well, I would like to see more implementation of a salutogenic approach to healthcare. There are basically two ways that one can look at healthcare. One is the traditional medical model or the pathological model, which seeks to detect, diagnose, treat, and prevent specific diseases. Not that that's necessarily a bad idea, it certainly has a place, but what's missing are salutogenic strategies. And the term salutogenesis was originally proposed by Antonovsky when he was looking at what he called a person's sense of coherence and looked at some of the dynamics that are involved in people who seemingly enjoy health. And this kind of goes back to the work of D.D. Palmer, who raised the question, why can there be a situation where two people working at the same job, living in the same home, eating the same food, find themselves in a situation where one enjoys health and the other does not? So salutogenesis literally comes from salus, which means health. Uh, some have even gone so far as to define in terms of invincibility. So, what do you do when you toast someone? Salute. You're wishing them good health. Why do soldiers salute one another? Because they're wishing each other good health and success and invincibility, a good thing to have uh, if you're going into a challenging situation as they are. In a salutogenic model, we're looking at strategies that create health. So, what's health? As we said, according to WHO, complete physical, mental, and social well being, not merely the absence of disease or infirmity. And other professions have looked at salutogenic strategies. A very powerful salutogenic strategy, of course, is the location analysis and correction of vertebral subluxations, which is where chiropractic has its focus. And when we look at the challenges that people are facing today, um, salutogenic strategies are conspicuously absent in the discussion in the media and in the public health community. Do you hear people saying, hey, it's important for you to get your spine checked for vertebral subluxation so you can adapt more effectively to the challenges you're facing? Don't hear that. You hear people saying, um, other than some small groups that advocate this, but certainly not the mainstream, it's really important that you take a look at your nutritional status, what you're eating. Um, it's important that you get out and exercise. Even if you have to maintain social distancing, you can certainly get out and walk. Walk your dog, ride your bike, get out and exercise. That's really important. Get some sun. Um, go out into nature. Make sure that you are following whatever spiritual path is yours. If you're a person used to going to church, don't let that by. If you're a person who utilizes practices such as yoga, tai chi, and the like, uh, continue that practice, even if it requires doing so online, remotely, or by yourself. or with other people maintaining uh, what you feel are appropriate social distancing guidelines. We're just not hearing that.
Mhm.
And these things could be significant factors in how well people adapt to the stressors that they're facing. You know, you hear
Mhm.
people say, oh, I need to eliminate stress, I need to manage stress. Well, one of the highlights of my career, and this goes back to the 70s, was when Hans Selye visited Palmer College and he spoke to the students and he made himself available to the faculty after. And it was really a fascinating story. He told us how he got into this whole stress thing. And he said he was a student studying medicine at the time, and he was in a class in differential diagnosis where the exercise was to look at the subtle differences in clinical presentations and try and figure out why the person had this disease rather than that disease. And he said this class was presented in an amphitheater, and kind of at the bottom on the stage, the professor would bring forth patients that had various problems and explain their history and their clinical findings. And then he'd call on students to go through the exercise. You know, how would you determine what this patient has and what the appropriate course of care would be? And he said, you know, I was looking at this parade of sick people passing before me, and I thought to myself, you know, they all seemingly have something in common. I'm not sure what it is, but there's a commonality there. And he said the professor apparently saw that his mind was kind of wandering and said, Selye, what do you think is wrong with this patient? And he said, why, doctor, he's sick. And everybody chortled and had a laugh at Selye's expense, but it started him on that path. And he talked about how the engineering concept of stress could be applied to animal physiology and ultimately to human physiology and how we interact with the world. And today, when most people hear the term stress, they think of something very negative. They think of, you know, the freeze, fight, flight response, that primitive response that is hardwired into us to respond to life-threatening challenges going back a long, 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 long time. And today we tend to trigger that, but the challenges we face don't have the same appropriate response. We don't have to run from a saber-toothed tiger. We don't have to fight much, or hopefully not very often, a physical assailant. Um, but if somebody cuts you off in traffic, or if you have a fight with your boss, or if you have a challenge at home, you tend to elicit that fight flight response without an effective means for expressing it. And what Selye pointed out was that this phenomenon of stress and adaptation isn't negative. It doesn't have to be negative. That's only one side. In fact, he called it dis-stress, dis-stress, which I think is kind of interesting because D.D. Palmer talked about dis-ease, dis-ease, uh,
Mhm.
where neurological dysfunction is present. And Selye said, you know, there's another side of stress. And he called it eustress, EU dash stress, as in euphoria. And he said, eustress is the good stuff. He said it's the spice of life. And you think about it, you know, why do people jump out of airplanes with parachutes for the rush? You know, why do they eat food that burns on the way out as well as the way in? Why do they watch movies that they know will likely make them cry? You know, they're trying to expand the scope of the human experience.
You fly planes, or historically you would fly planes, right? That's that rush you're
Yeah,
talking about, that you stress.
yeah, absolutely. You know, it was really a rush. A copy of Flying magazine arrived one day that had on the cover, "You can fly a fighter jet," and I thought, well, that sounds cool. And
Hmm.
I read the article, and yes, you can. You know, there are places that make that available. So I did
So
some
so if
aerobatic
so
lessons
so not to cut
in
you
a
off, but
fighter jet.
I think that you got that point across of just kind of looking at things from a different angle. If the media would cover things with
Yeah,
a different narrative, psychology, and imprint in our populations, a different message, that would be helpful And that would come from the research that we did, leading to them taking it more seriously, or leading to them getting an expanded scope or an expanded context of what a salutogenic model looks like. What else can we see change in society if we have more salutogenic oriented research being published? Like I said, if we had $100 million
Mhm.
invested, if we had the people that were trained
Sure.
to do the research and then get it published and then disseminate it, because I think the dissemination point piece is also really important. I think a lot of the research that you've done and other people in the profession have done has not necessarily reached the people that it needs to reach, and it hasn't necessarily gotten into those circles of people that are involved in policy change. But what is
Exactly.
what else does the effects of this? What are the other effects in society do? Because I'll just speak for a moment on what I think could happen. I think
Mhm.
that right now we have no presence of chiropractic on college campuses. So within the university context, no college students are seeing chiropractors in their local health center or their campus health center. There's no pre-chiro clubs present on campus sharing the research of chiropractic. There's no training being offered in the name of salutogenic health or chiropractic to undergraduate students that are in maybe a laboratory on physiology and looking for a senior year publication. There's none of these opportunities, or there's none of these signals that are out there that are kind of shining a light on, hey, there's a whole different world of thinking available to you that aligns with your values and aligns with the way that you're already thinking. But this is a professional way of putting it into context. And so, if we had science fairs of pre-Chiro students presenting on research that they did in their senior year independent study under the guidance of somebody like you or the department at Sherman, I think that that would lead to a trickle down effect, or a ripple effect through college campuses, which I don't think is possible without us really presenting the potential narrative psychology, like the implications of having people that are on this campus think differently about their health. Right? Typically, you have the freshman 15 in college, which is gaining 15 pounds. What if the freshman 15 was adding 15 salutogenic habits or salutogenic oriented lifestyle expressions to your life? By going to college, this enabled you to do stuff like that. So I just would like your reflections on what are some other things that could be that could happen if we had policy change.
Again, we go to, the first day, which was, what's my life about? And that's human empowerment. We are seeing a situation where people perceive themselves as being out of control of their health, of being dependent on drugs or healthcare professionals to provide them with health, rather than allowing themselves the strategies necessary to grow in all of those dimensions: physical, mental, and social. And if we saw salutogenic strategies more broadly implemented, and we saw less dependence, and we saw individuals that perceive themselves as being competent, capable, adaptable, resilient, able to deal with whatever life hands them, and to do so in the context of their dreams and core values, I really think this could transform humanity. But we're, as you noted, far, far away from realizing that goal. I know there are some schools that have pre chiropractic clubs, not many. I know that we provide services to a number of athletic teams from neighboring colleges. I think we have 5 or 6 here in Spartanburg. It's kind of a college town. But there needs to be much more of that. When people find out, for example, that look at the athletic aspect of it, that most major athletic teams have chiropractors. Wouldn't you like to have a chiropractor for your team here at this college? Yeah, yeah. It's a way of subtly getting into it. And wouldn't you like to have a career opportunity where you can effectively influence all dimensions of the human experience in a favorable direction and in a relatively rapid, safe manner that allows you to really have a significant impact on your community. But as you said, that we have to not keep our light under a bushel basket. We have to let the world know. And we have to get to policymakers that can see beyond lobbyist dollars and can, and I know we're really getting into some idealistic stuff here, but look at what's best for their constituents and what's best for humanity. Um,
What would the human power need to be for us to actualize even $1 million? Or you said 1 million is not a lot. That's just one or two studies. But
mhm,
what about $10 million? I think that's realistic to say that if we focused our intent as a leadership on raising $10 million in the name of chiropractic for the
mhm,
profession, strictly to do research, what type of human power is needed for us to actualize some of those goals of maybe having 5 published papers in reputable journals and um, training up the people that are needed. How many people do we need per research study? It depends on the research study and the
Sure, it
design, of
depends on the
course.
side and the breadth of the research and what talents you need. Um, One of the things that I really have no expertise in is philanthropy, although I certainly understand the need for it.
Hmm.
Um, you drive by a hospital and you see someone's name on it, perhaps the name of a celebrity or the name of someone who is, financially well endowed, and perhaps someone helped them. We hear stories all the time about chiropractic miracles. Some of those individuals undoubtedly uh, have the potential to become philanthropists for chiropractic if they understood that the opportunities were available. So that's one possibility. Another, as you mentioned, is getting into the grant system. And grants, in the context of healthcare, most people think of NIH, the National Institutes of Health. And of course, that's where the big money is. It's also a highly competitive environment, and it's one where the individuals making decisions may be somewhat biased, not necessarily against chiropractic, but are so steeped in the biomedical model that salute stuff seems kind of avant garde. But we can do that. There are other grant opportunities. There are independent foundations. Some of
Hmm.
those might be areas that could be tapped. Um,
Okay. Okay.
Local
All right.
government.
Well, we'll have to continue this
I mean, this could go
conversation.
on and on. I see we're at 42 minutes already, and that's kind of
Yeah, yeah, we got to
over
wrap
your
it.
limit. But we,
I'm
yeah,
just
I told
proposing.
you when we started, the danger is I can talk forever. So
Well, there's lots of material available that you've already developed and delivered
sure.
that's free on YouTube. If we just search your name, a whole list of things came
Yeah,
up.
I'd say go to the Sherman College site. You
Mhm,
can also search Google Scholar, and a bunch of stuff will come up.
mhm.
Um, but I'd say if you want to get started with something simple and kind of all in one place, go to sherman.edu, the research site, and I think we have 4 videos there that you can start with, and then
Awesome.
go from there.
Thank you.